Hello, good morning.
Hi,
My name
good
is
morning.
Andrew Mantone. I'm a physician
Andrew.
assistant student. How are you today?
Good, how are you?
I'm pretty good. So tell me, can you actually just confirm your name and date of birth for me real quick?
Meha Patel.
Okay.
And February 5th, 1996.
Okay. Great. So tell me, Meha, can I call you Meha?
Yes.
Okay, great. What brings you in today?
So I have had like a red and painful rash along my hip for, I would say, like about a week now. And it's been like really painful and itchy. And at first I thought it was just like irritation, but like it's been getting worse and it's been getting more painful. So I thought I would come and get it checked out.
Okay, sorry to hear that. So before we get into your condition, I just want to get to know you a little bit better, just so we can have a little bit of background.
Okay.
We try to do this for all of our patients,
Okay.
just to get a sense of who you are, get to know us a little bit. So you're 21 years old, correct?
Mhm.
And are you in school? Do you work anywhere?
I actually go to PA school.
Oh, really?
Yeah.
Wow, very cool. What school do you go to?
Jefferson?
Oh, awesome. Yeah, I've heard a lot of good things about that school.
Yeah.
That's great. Do you know what field you want to be in, or anything like that?
I'm not too sure. I'm trying to not be biased going into rotations next year, so
Right.
I'm like trying to keep an open mind.
Okay.
Do you have an interest in what specialty you want to go into?
Yeah, I want to go into emergency.
Oh, awesome.
So,
Yeah, my uncle's a emergency PA in Florida, and he's kind of like what inspired me to go to PA school. So
very cool.
Yeah.
It's nice to hear. So go into a little bit about what you say your general state of health is, other than your rash that you said you had.
Generally, like my health is good. Recently, I actually had an accident and I fell, and I had to get hip surgery. So it's around the same area, which is what scares me. Like the rash is like in that same area, but everything from the surgery had healed, and then now it's like the rash appeared. So I'm like, I thought that part of the bad time was gone, and then now I saw this rash and it's been getting worse. So I'm a little concerned that it might have to do with that.
Okay.
But other than the hip surgery, everything was fine.
Okay.
Yeah.
And excuse me if you mentioned this, but how long ago was that hip surgery?
It was 2 months ago.
Okay. And did you have any therapy for that, or were you in a brace or anything like that?
Yeah, it was like a pretty minor surgery, but I did have to get physical therapy done, and everything went well. All of the plan that the doctor came up with, like we followed through with it, and everything was.
Right. Do you
pretty
remember
well.
what type of surgery it was?
I know that it was like in the hip joint. I think it was like reconstructive. I'm not really sure.
Okay, that's okay. You don't know.
Yeah.
Okay, I'm going to go into a little bit more about yourself. Are you married?
No, I'm not.
Not married. Okay. And tell me a little bit about your past medical history. So these are things like hypertension, diabetes, or anything that I should know about today that may lead me to help figure out what's going on with your condition.
So no hypertension or anything like that. I do have type 1 diabetes.
Okay.
And so I've been monitoring that. And I take metformin for that as well, and then also the insulin pump. But other than that, everything is relatively good. I've had like skin problems, so I've been taking skin medication. But nothing like no skin problem has ever occurred anywhere else but my face. So
Okay.
it was a little concerning when I saw the rash.
Understandable. Yeah, I understand how this is concerning, especially because it's so sudden and you don't know what's going on. So I can understand how you're fearful of what's going on. We're going to try to take a look at it today and see what we can do for you.
Thank you.
So we're going to go into a little bit about exactly what might have caused this.
Okay.
So do you remember a specific event or anything that happened, like some people say they were hiking or outdoors, indoors, things like that?
So I was like pretty much indoors for the past, like ever since my surgery happened. It was pretty not able to move that much, and I was getting around, moving around the house, and then also like I would get to school, but I wouldn't move too much. So I don't really. I think it started out smaller and then it progressively got bigger. So I haven't really noticed it like anything leading up to it until like I was like, oh my god, like it's it's getting bigger and it's more painful, so I should like look more into it. But no specific events that I can recall that led
Okay,
up to it. Yeah.
that's no problem. And you said that you noticed it about a week ago. Is that
hmm
correct? Okay. And do you remember exactly where you were or how it happened when you noticed that you had like, oh my gosh, there's this huge rash on my hip?
So at first, like when I went to shower, I think this was like before a week ago when it was like smaller, and I think there was just like two like or three what looked like pimples, and so I thought maybe it was just irritation from like the clothes or something that I was wearing, and then um, I think a couple days after that I woke up and I was like in like it was very itchy and also painful, so I was like something is not right, and then like it was just bigger than the three initial like irritation pimples that I saw before, and it was like I thought it was spreading, and so I did use polysporin, I think, yeah, polysporin, um, and that didn't seem to help, and so I was getting more concerned.
Is there anything else you tried other than the polysporin that may
Um,
have alleviated it a little bit?
no, I mean I did take Motrin at one point when it was very painful, but I only took that like one day out of the past week, and I only took I think two Motrin, and that didn't really help too much. So I don't really like taking extra medication.
Yeah, I'm sorry to hear that that didn't work. Um, can you tell me a little bit more about anything that may have made it worse?
So I'm thinking I don't know if this is just in my head, but when I like wear loose clothing, it's definitely feels better than when I wear tight clothing.
Okay.
So and for school we have to dress up constantly into business professional clothes. So
Okay.
I do think that that is one of the reasons why it's probably not gotten better if it's supposed to be. I'm not sure.
Right. You may have mentioned this, and forgive me if you have, but have you seen any progression of the rash from when you first noticed it to how it is now?
Yeah, so like like it started out very small and then now it's I would say like 4 or 5 times the size it was. Yeah.
Okay.
And the pain has also increased with I guess how much it's spreading. So it's like the same type of pain but it's just increased.
Right.
It's more pain to the touch, I would say.
Is the pain, is it always there? Does it come and go?
So I think it's always there, but when you touch it, it hurts more.
Okay.
I guess when it's irritated, or when there's tight clothing on it constantly, that would hurt. That hurts
So
more too.
would you say like when your clothes kind of rub up against it, that's when it gets more
Yeah,
irritated?
yeah.
Okay, I understand that. And you mentioned the pain. So could you describe the actual pain that you're feeling? Is it more like a dull, sharp, achy?
So I think it's more like not aching from the inside. It's more like sharp pains, but I would say like on the surface of my skin.
Okay.
So it's like if at first I thought that's why I thought it was pimples because like I mean you would probably understand this like when you're getting like a rash or a skin irritation of some sort, it's like that, but it's now at this point it's like so much worse than that. Like when you touch it, it would hurt. Like normally if I get a pimple on my face, like it hurts, and then I touch it and that hurts more. But this is like that times like 10.
Okay, so it's worse than like
Yeah.
just a regular pimple.
Yeah. It
And you would
hurts.
say that you can differentiate between the pain of, say, like a normal pimple and this
Yeah.
is much worse.
And it's also like more spread out and also like red all over. So I didn't really think that that was like normal.
Okay. I'm going to take a look at it a little bit later, but
Okay.
is this more of like a widespread all around red, or is there patches? Can you just kind of describe the rash, I guess, for me a little bit?
So it's the area is red completely, and it's like a little scaly.
Okay.
So I didn't know if I should put like moisturizer or something on it, but after I tried the Polysporin, I didn't really try anything because I didn't want to make it worse.
Okay.
Also, it was like stinging, so I just like left it alone. And then it's like sometimes it's dry and flaky, but sometimes it's also like there's like pus. So
Well, we're going to take a look at it, like I said, a little bit later, but
okay.
I just kind of want to get a better picture for right now.
Hmm.
And can you tell me if this has ever happened to you before?
No, other than like the acne that I've gotten on my face, which is different than what this is. Nothing like this has ever happened to me.
Okay, so this is kind of a new sort
Yeah.
of thing that came along. And can you tell me on the scale of like 1 to 10, with 10 being the worst pain you've ever had in your life, can you rate this on that scale for me?
I would say it's about like a 7, 6, yeah, 6 or 7.
Okay. Yeah, we like to do this scale with our patients because it gives us a sense of how urgent it is and what our diagnosis is going to be from how much pain you may be having, and
Hmm.
among other things. But it gives me a better idea of what you're going through. So can you tell me if the pain is always there? Does it come and go? Do you notice that like maybe a certain time of day it's worse? Anything like that?
I guess like I mentioned before, it's like it's worse when I'm wearing tight clothing. So like during the day when I'm in class, it's worse because
Right.
I'm sitting and then there's like tight clothing. So I've tried to wear like looser business casual clothing, but it's still like anytime like that area has clothing over it, it hurts. And so
Okay.
I guess timings that would be better would be like when I'm sleeping because I'm asleep and not thinking about it or touching it, and probably like when I shower.
Okay.
Yeah.
So you mentioned sleeping. Have you ever woken up in the middle of the night or anything like that with a lot of pain?
So like in the past week, I would say like the past 2 or 3 days have been. I would be able to sleep well, but then once I'm sleeping, I'm like tossing and turning, and then that like rubbing,
Irritates you?
yeah, irritates it.
Okay.
And then so that's why I like am paranoid to sleep again when I wake up from that.
Right.
So, because that's like a very uncomfortable feeling when you wake up from that.
Okay. I like to do this with a lot of my patients. I'm just going to review just to make sure I have everything right.
Mhm.
So you said you had this rash. Started about a week ago. Started off small. It got much bigger. And you tried Polysporin.
Mhm.
Didn't really help. And when you wear tight clothing or anything that rubs up against it, it makes it worse. You said the pain was about a 6 or 7 out of 10, which is concerning to me.
Mhm.
And like I said, it hurts when you touch it, and it's more of like a scaly red rash.
Mhm.
Is there anything else that you want to tell me about it that I may have missed?
No, I just like want to emphasize that it is like close to where the stitches were for my hip surgery, so I'm like nervous that it could be related to that. I'm not really sure if it is, but just because it's in that area, I was a little nervous. But I got like my checkups after my surgery, and all of like the stitches and everything were good. But then now this rash came along, so I'm just
Okay, that's something that we're definitely going to look into for
Okay.
you
okay.
to make sure that if there is a correlation, we can catch it.
Okay. Thank
So
you.
I'm just going to ask you a couple more specific questions.
Mhm.
I know, sorry, this is a lot of questions
That's okay.
but I just want to get a better picture of what specifically is going on. So you mentioned that you had the rash.
Mhm.
Have you noticed any associated lumps? Can you tell me if the area is raised?
So there are like I wouldn't say lumps. It's just like I guess pimples are elevated a little bit. So it's like some lumps in the beginning, and now it's just like red. I don't know how else to describe it, but it's irritated.
Okay, but it is raised. you
Yeah,
said?
there was. Yeah, there are like a few raised spots.
Okay.
Also, there was like pus coming out of them too. So,
Oh, there was. Okay.
Yes.
Can you describe that pus for me? Was it what color?
like clear and white, I would say.
Okay. And is how much? Just give me a ballpark of how much pus you would say is coming out.
So it's not constant. I think it was one day out of the past week, like 2 days ago, I think, where I like woke up and there was like a little bit of pus there. So it's not that much. I was just concerned.
Okay.
And like I just went to shower. So,
Right. Yeah. Thanks for letting me know. That's definitely something that we like to get everything from our patients. So
Mhm.
thank you for sharing that with me. Have you had any? You said, I don't know if you mentioned this. Any like itchiness or
Yeah,
anything?
it's been
in the area?
itchy.
Okay.
It's
And
been itchy, but then when I itch, it's painful. Or I try not to itch because it's painful.
Right.
But it's very hard to not itch.
So it's
So
sort
it's
of
just
like a
uncomfortable.
mosquito bite when you itch it and then it hurts.
Yeah.
It's just like very, yeah, it's very irritating when that happens. Have you noticed any dryness of your skin?
So yeah,
Area?
sometimes it's dry, and so I was like confused if I should put lotion or moisturizer, but
Right.
I didn't do anything after that.
So you mentioned that it was red in the area. Have you
Mhm.
noticed any other color changes that have been?
No color changes. Mostly red. Yeah.
Okay. Have you seen any changes in your hair or any of your like fingernails, nails or toenails?
No.
No. Okay. And have you seen any changes in size or color of any of the moles? Like this could be anywhere on your body.
Mm-mm.
So we're gonna go into your symptoms a little bit later on, but for right now, I'm just gonna take a little bit of history on yourself and your medical history.
Okay.
So you mentioned that you have diabetes and you're taking metformin.
Metformin.
Sorry, metformin.
That's okay.
And do you know the amount that you take every day?
I should know this because I've been taking this for a while, but I'm not sure.
That's okay.
Also, not sure about like the insulin. Like I can't think of the insulin name.
Right.
But I take it every day, and metformin is by mouth.
Okay.
I'm not sure. I've been taking it for so long that it's just like routine. I'm not really sure what the dosage is.
Okay, that's fine. And have you changed your dose recently, or is it
It's been the same. Yeah.
Okay. And you mentioned that you're on the pump. Is that
Mhm.
correct?
Yes.
So that's something that. Do you change that? Like,
No,
how
that's-
good are you? by-
That's been the same since. I think we change it like once a week.
And you're pretty good about changing it.
Mhm.
Okay. And I think you mentioned a medication for your skin.
Oh
You know
yeah.
what it's called?
I'm taking Accutane
Okay.
for my skin, and that is 30 milligrams. I know that one because that's recent.
Right.
And that's once a day, and I take that as a pill. And I just started that like 4 months ago.
Okay. And how has your skin been since then? It looks pretty.
Oh,
pretty
thanks.
well.
Thank you.
But
Yeah, that's been one thing that has been working.
Right.
Yeah.
Have you noticed any side effects from that medication since you started it?
No, I like talked to my dermatologist about like a bunch of side effects that can possibly happen, but I think that's I don't want to jinx myself, but that's been going pretty well for me.
Yeah, I know that drug is it's controversial for a lot of patients because of the side effects. So
Right.
I'm glad to hear that you haven't been having any since then. So other than these three, the metformin, ear pump, and the Accutane, is there any other medications that you take? These could be over the counter or herbal supplements, vitamins, things like that.
I take iron supplements.
Okay.
And B12 because I have anemia,
Oh, okay.
but I'm not really sure about how iron is. I can't think of what the dosage of both of those are, but they're over the counter supplements.
Okay. And you just buy those at your local
Yeah.
pharmacy, correct? Okay.
Mhm.
That's fine. If you don't know the dose, we can't expect our patients to know everything these days, you know. But I'm glad to hear that you're taking this for your conditions. And any other medications I should know about?
No, I think that's it. That's it.
Okay. So, do you have any allergies? These can be food, bugs, anything like that.
No. I used to be allergic to peanut butter, but then I grew out of it.
Okay.
But that was like when I was really little, so
Okay, so nothing.
nothing currently, no.
Okay. And have you noticed any latex allergies? Things
no.
like gloves, condoms, things like that. Okay. And how about iodine?
No.
And do you know if you have a chlorhexidine allergy?
No.
This is after surgery. They put on like before surgery and.
I don't think so. Yeah.
Great.
Maybe they used it during the hip surgery.
They may have. Yeah. So we're gonna go into your past medical history now,
Okay.
and this is something that I know you're relatively young,
Mm-hmm.
but if you don't remember anything, that's okay. I don't expect everyone to remember anything, but
Okay.
this is kind of in your childhood and your past. So, when you were growing up,
Mm-hmm.
do you remember any illnesses that you had as a child?
I did have pneumonia when I was like really little. I guess at the age of 5, but I don't remember much about it.
Okay.
Other than that, I was like relatively healthy.
And were you in the hospital for that? Do you remember?
I was in the hospital just because my parents like didn't really know what to do,
Right.
but I was treated for it. I didn't have to stay in the hospital.
Okay, so it was more of a outpatient
Yeah.
type of thing, like the emergency room?
Yeah.
Okay. And since then you haven't had any associated problems with that?
Nope.
Okay. Can you think of anything else that happened in your childhood?
No, I can't. Nothing that like stands out. No.
Okay, that's good to hear. So more specifically, I want to know about certain conditions that a lot of people may have. I know you said you had any childhood illnesses, but we just want to make sure that we have everything down. So these are just yes or no questions, very simple if you've had any of the following conditions.
Okay.
So measles?
No.
Have you ever had mumps?
No, but I did get the shot for that.
You did? Okay, that's good to hear. And how about the chicken pox?
Nope. Also, I got a shot for that as
Is
well.
with the vaccine?
Yeah.
Okay. And do you know if you've ever had rheumatic fever?
No.
Okay. And what about scarlet fever?
Mhm.
Have you ever had polio?
No.
What about any psychiatric disorders that we should know about?
Nope.
Okay, great. So you said you didn't have polio. Have you had the vaccine for it?
Yes.
Okay. How about the MMR vaccine? This is measles, mumps, and rubella.
Yeah, I did.
Okay, great. Let me see here. Have you had your flu shot this year?
I have not, but I do. I've been pretty good about getting it for every year for the past 5 or 6 years at least.
Okay, that's good. Yeah, I encourage you to get that every year. If you don't like shots or anything like that, there's also the spray now. I don't know if you've ever done that.
The mist.
The
thing
mist,
on
yeah.
your nose, yeah.
Yeah, I actually prefer that, even though I'm learning how to do like shots and things like that. But I actually prefer the mist.
Okay.
It's much easier. Not painful.
I think you just I think I've gotten it twice actually. They just like spray it and then you just
Yeah, it's very simple.
Yeah, it's gone.
And, you don't get the flu then.
yeah.
Fingers crossed.
Yeah.
Okay. How about tetanus? Do you remember getting that? shot?
Yeah.
Okay. And
That hurt a lot.
yeah, I
remember
remember that too. When I
Yeah.
was 12, I got that.
Yeah.
Okay. How about diphtheria?
I think so. I'm not sure.
Okay, we can. I'll review your chart and can see if you've had that.
Okay.
Or not. What about pertussis? This is for like it's called whooping cough.
Cough. Yeah.
Yeah, I had that. Okay, have you had the hepatitis B vaccine?
Yeah.
This is like the 3 shots.
The 3. Yeah.
And how about you said you had the chicken pox vaccine? Is that correct?
Yes.
Okay. And I'm assuming you. Shouldn't assume, but have you had the pneumococcal vaccine that you can remember, or if not, it's okay.
I'm not sure.
Okay.
Is there a difference between pneumonia and... Is it for
it's
pneumonia?
It's a type of pneumonia, and typically we give this to older patients.
Okay.
So I'm not sure if one of your providers has given it to you or not. Which is
Okay.
why
Just because of the pneumonia. Yeah, I'm not
Right.
sure. I'm really not
Okay.
sure.
That's fine. We can check later. So we're going to move on to more recent illnesses in your adult life. So
Okay.
do you remember anything within the last couple of years that, like any illnesses that I should know about?
Well, besides the anemia, I don't know if that's like an illness.
That's what it is.
Let's just turn it on. Did it work?